shingles, which are more prevalent and more severe in these older adults. And we cannot overstate the importance of these vaccination, because not only it prevents and avoids the seriousness of disease that can significantly impact the health of older adults, but also reduces the complications by preventing these diseases. We reduce risk of severe complications that could lead to hospitalization or even death, and also enhances the longevity as well as quality of life. Effective vaccination support better health outcome, help maintain independence, thereby improving the quality of life for the aging patients. And today's webinar will provide a valuable insight into all the essential vaccines for adults, the optimal timing of their administration, the special consideration for this older population. And with us is moderator Dr. Anahita Chauhan, who have just been introduced, and she has done so much work. And when she talks about this problem, she speaks from her heart. With her are experts from all over the country: Dr. Anil Sakare, Dr. Gini Gupta, Dr. Lilita Bajaj, Dr. Pranay Phokan, Dr. Punita Nayak, Dr. Reshma Nigam, Dr. Shelja, and Dr. Vidya Suresh. So all these people will throw insights and make us increase our understanding and positive impact on the health and well-being of our. Thank you for joining us. I look forward for our shared learning and discussion vision, which we all carry towards. Thank you very much. Over to you, Dr. Anahita.
Thank you. Thank you,
Please
Dr.
Please involve all the panelists.
Of course, of course. So thank you, Dr. Anju Soni. And I think my role as a moderator is just to ask questions. And it is the panelists and the experts who will answer these questions. Rightly put by you, Dr. Anju, that adult vaccination has been really missed over the time. And we have focused a lot on childhood immunization and on pregnancy immunization. I'm going to, is my slide visible? Is my slide visible?
Yes, yes, ma'am.
Yes, ma'am.
Okay. So I'm just trying to go to the next. One moment.
Not moving, Dr. Anahita.
Yeah, now it's moving.
Yeah,
so I'm going to actually ask all the panelists questions, as you have said. And of course, any of you is free to add to whatever has already been said. Now we know that a woman's life begins when she is born and it ends at the end of her life. And we see women in the adolescent, preconception, pregnancy, postpartum, and in the older menopausal age group as well. Some of these areas are very well known for vaccination and some are not. So let's begin by some general questions. Would you like to answer, Dr. Lalita? What is actually the difference between adult vaccination and childhood or adolescent vaccination? Very simply.
Diseases which occurs in the childhood, they are different from the adult. So the vaccination required for the childhood, they are different than the adult.
That's right. And if Dr. Anil would like to add something to this.
Actually, in few diseases, the childhood vaccination is mainly for boosting up the immunity, that creating an immunity in the body. But in the adults, we may need to trigger that immunity again. So repetition of the vaccines which we took in the childhood, we may have to take it in an adult age, even at the extremes of the age also. Ages
Absolutely.
also.
Absolutely. So basically, how does vaccination in adults differ from children and younger women? Anybody would like to add something about the immune status? Dr. Reshma or Dr. Anil? Go ahead.
So,
Yeah.
though the children in the children and young women, as
Hmm.
already I said that we need to create an start the immunity in the body.
Right.
But the adult just need to trigger that immunity. So
Right.
there may be a dose variation. Also, there may be a repetition of the doses. In the childhood, we may have to take it in a very small periods also. But in the adults, that period might be differ. It may be in the ages 5 years. Few vaccines
Right.
we may have to take up to every 5 years. So some vaccines we have to take every 10 years, because the function or the purpose is that just we have to boost up the immunity, and we have to maintain the immunity against those diseases. Few
Absolutely.
vaccines like influenza vaccines, as the virus strains changes every year, so we have to take in such situation the in also adulthood we have to take this vaccination every year.
Correct. Absolutely. So, if any of you would like to tell us what do you feel is an ideal adult vaccination schedule? Or is that what we are going to discuss in the coming hour or so?
In
Yes.
ideal vaccination schedule for the adult, the most of the diseases which can be prevented with the vaccination should be covered. As cervical cancer, we were not knowing that it is because of the virus, and we could make out the vaccine for that. Most of the cancer they don't have any, but only the viral infections or tetanus that we can cover, like influenza, and so we are having vaccine. But now with the improvement in the cervical cancer vaccine, we can prevent the cancer like diseases which is very common in the India. So vaccination is very important, and the ideal vaccine should contain it should be given at the optimum interval, with the maximum effect, and with the minimum reaction. There should be less reaction to the factor.
Yeah, absolutely. So
And
basically, yes,
one thing
please.
more.
Go ahead. Yes, Dr. Reshma.
Yeah, thank you so much. One thing we should consider also, if we are giving vaccination in the adult women, if we are giving live viral vaccines, pregnancy should be delayed for at least 28 days, or in
Right.
cases of HPV vaccination, it should be delayed for approx 1 year.
That's right. So we are going to come to that now. And I thought that we'd begin with HPV. And we know that we've been talking about HPV for the last 15 years. It's only in the last few years that there has been some momentum gained and newer vaccines have come up. And this was something that I thought was very nice, because somebody said the speed at which COVID vaccines, put the link between infections and death, focused on the miracle or the science of vaccination. And oh, if only we had a vaccine for cancer. But yes, we do have a vaccine for cancer. And I think the chilling truth is that 1 out of 4 women who die of cervical cancer worldwide is an Indian. And by the time we finish this panel, I don't know how many women have died. So, why HPV vaccination? Dr. Lalita?
HPV vaccine is important because the cervical cancer is the second most common cancer in the India. It is fifth common cancer with the amongst the every 8 minutes the female is suffering from cervical cancer is diagnosed, and the death rate is also very high, like 73 or 77,000 women they are dying of cancer. And we come to know that HPV virus, human papilloma virus, causes 95% of the cervical cancer. So we come up with the scientists they come with the strains that causes the cancer. More common are 4 strains. They are 16, 18, 6 and 11. These are the strains virus which causes the cervical infection and cervical cancer. Other strains they
I would like to correct you, ma'am. 16, 18 are oncogenic and 6, 11 cause the genital.
benign diseases. Yes, 6 and 11 causes benign diseases. 16 and 11 they causes the invasive cervical cancer. So previously we were having only bivalent vaccination. Now there are quadrivalent and monovalent. So the with the monovalent, most of the strains they are covered with the quadrivalent, but now it is better to give the 100% results, so we can give with the nonavalent. But nonavalent is not prepared in the India; it is prepared outside the India. So the cost is one of the factor. But best is the nonavalent should be given, and the dose schedule for the 9 to 15-year age, it is 0 and 6, and for above 15 to 26 year of the age we can give 25-year age. So for that we require 3 doses, 0, 2 and 6 month. And
Schedule in a bit.
huh?
If anybody-
Madam, I am not able to.
Hello?
Now I can hear.
Yeah. I said we'll come to the dose schedule in a bit. If anybody else would like to add about what is the global strategy for cervical cancer, because we know that one woman dies every 2 minutes and it can be prevented. So anybody would like to add what is the global strategy? So basically, FOXY is part of the global strategy, and the global strategy is 90, 70, 90, where 90% of girls will be fully vaccinated with HPV vaccine by the age of 15. 70% of women will be screened at least at 45 and again at 35 and again at 45. And 90% of women identified with cervical disease will receive treatment in the best possible way. Now, this is the goal for 2030. I really wonder how close we are to this goal, but definitely more and more women are now asking us about cervical cancer. Can Dr. Reshma, can you add what are the real world benefits of HPV vaccination? Because we talk about cancer, which is very hypothetical.
Yeah. Real world benefits, I think it can prevent from genital warts besides cancer. And both forms, even both from CIN.
Yeah.
It is preventive, not a treatment for invasive cancer.
Right. So basically, there are genital warts and the earlier stages of SIN1 and SIN2, which are also prevented. And in fact, one of the good studies from Australia has shown that vaccinating boys as well as girls has proven that they hardly have any cases of SIN3 nowadays. So it's a great advantage to vaccinating boys. I'm sorry, I can't identify one of the faculty. Ma'am, I'm not sure. You haven't spoken yet, ma'am.
I am Dr. Vidya.
Hi, Vidya. So if you could also just throw some light on this. What do you think is the advantage of nonavalent or 9-valent?
It covers many of the totally 9 strains. That is 7 more strains, which even though is less prevalent, the chances of getting cervical cancer will be reduced.
Yeah. And also the other types of cancer, because up till now we were focusing only on cervical. So any of the other cancers as well?
Vulval as well as anal cancers are also reduced if you give 9.
Right. If you give the 9-valent.
9.
Even oropharyngeal
penile cancer, oral cancer.
Absolutely.
Vaginal cancer, vulval cancer.
If they are given to the boys
good to meet you also, Dr. Sheila.
Yeah, it can be given to the boys and adult male also to prevent penile cancers. Correct. And oropharyngeal cancers also.
Absolutely. Yes, so the oropharyngeal cancers actually are very few in number, and there is no real screening program or vaccination for them. but we should actually promote vaccination in boys as well. So how do we overcome these barriers? Dr.
It's
Shaila?
by creating awareness. That's what we are doing in our hospital. The mothers are coming and we are educating them and asking them to vaccinate their children, so that this awareness, and we are going to the schools also to promote about the vaccines and creating awareness also in the public.
Absolutely, absolutely. And I hope that all of you and your daughters have also taken the vaccine, because, you know, as I say, charity begins at home.
And first of all, I started with my hospital staff only, promoting them and creating awareness, so that they are also doing the social work.
Wonderful.
Dr.
I
Anita,
will likely to add, the goal is quite wonderful that the target is by 2030.
Yes.
90, 70, 90, but it will be really very difficult, particularly in third world countries like India. We may say that we are now second world country or a borderline. Unless we include this vaccination program in our government vaccination schedule, Indra, Dhanush, or whatever it may,
Yes.
and then only the total number of children will get vaccinated and get benefited. Otherwise,
Absolutely.
I don't think that with this cost we can hardly vaccinate 5 to 10% of our target population.
So, in fact, you will be happy to know that Foxy has been working exclusively with the government to try and push that this vaccination should become a part of the schedule. And in fact, some years ago, I think Punjab and Uttar Pradesh and some other states did take up the vaccination, but there's always a political.
Yeah, it is not Sikkim, Punjab and Sikkim. Punjab and Sikkim is taking the initiative and they have almost completed very successfully.
Absolutely. Yeah. But I guess in smaller states, it is easier. In larger states, it's a larger problem.
Dr. Anita, I will be joining from my mobile. I've been invited.
Sure. Not a problem. Go ahead.
Of Diya Kumari for some work.
All right.
The call, but I'll be there from my mobile.
Sure. No problem. We are having hopefully a pleasant discussion.
No, I'm there on mobile. I'm logging from this laptop.
So I think one of you ladies was mentioning that now the bivalent is not available and there is quadrivalent and nonavalent. Any of you has used the Serum Institute vaccine? Dr. Anil, your hand is blocking your view. Yeah. Has any of you used Serum Institute vaccine?
No, ma'am. I don't have any experience about this serum. Yeah.
Only Gardasil.
Gardasil only we are using.
Yeah.
I think all of us are comfortable with Gardasil. And Serum Institute of India still has to kind of prove itself. But of course, that will be the vaccine that the government will use if they are going to use in the programs. So we should be aware that it is like Gardasil 4 and it can be safely used. So coming back to the doses, I think Dr. Shaila mentioned that 2 doses for women, for girls less than 15.
Yes, 9 to 14 we are advising 2 doses, 0 and 6 month. And above 14 years, where up till 45 also it can be taken, but up to 25 we are telling 3 doses, 0, 1 or 2, then 6th month.
Yeah, but because bivalent is not available, we should be basically saying 0, 2 and 6.
Yeah, then but we no more booster doses advised.
Right. So I think if we move the focus from saying that this will prevent cervical cancer and we talk more about the vaccine in terms of against HPV, it may make a lot of difference. I'm going to just skip this. I just wanted to show that gender neutral vaccination is what has been promoted using Gardasil 9. And this is a very good opportunity to vaccinate more people, because otherwise everybody thought that the girl was responsible, the girl was stigmatized, and the girl was sort of punished. Now, if you say that it is a gender neutral vaccine, it becomes equally important to give the boys as well as the girls. I think I just had a few points to make that in the world, girls and boys are given this vaccine to even 45 years. But in India, it is only up to the age of 15 that the boys are supposed to be given. And beyond 15, it's your judgment whether to give or not. Hopefully, this DCGI approval will come in the next year or so. So then we can safely give boys as well as girls. So this was about Servavac, and this was about Foxy. So if anyone has any points to add, how do you counsel a woman who comes at 35 saying, I want the vaccine? Do you give it?
Yeah.
Yes.
Yes.
Okay. But I think here the caution should be that it won't be as effective. And of course, if the patient can afford Gardasil 9, you would prefer that over Gardasil. All of us agree on this?
Yes.
Yes.
Right. Okay. So now very quickly, we're moving on to preconception vaccination. And
Excuse me, ma'am.
yes.
I have a question. I had a patient of CA vulva, CIN, which
Right.
she's positive HPV 18.
Right.
Should this vaccine help her?
So the vaccine may or may
Just
not.
benefit of doubt.
Yes, she can still receive the vaccine because it will protect her against other strains, but the vaccine efficacy will not be as much. So she will require proper screening and follow-up as well. So no patient should go away thinking that the vaccine is going to protect.
Yeah.
Yeah, there are a few other points like in
Yes, sir.
pregnancy, whether the vaccination should be given or not, it's a common question. And we have some patients who have taken the vaccine first dose and suddenly she came to know she's pregnant. And in such a situation, what should be done? The second
Nothing
dose
should be done.
Yeah.
The second dose should be postponed till her lactation period.
Exactly. Yes. Yes. It should be till lactation. It should be postponed. Yeah.
Yeah. So I think, patients say, oh, I'll finish taking the vaccine and then I'll get pregnant. I always tell them, you take the vaccine. If you get pregnant, you defer the doses.
Exactly. Yeah.
Yeah.
Sometimes some patients, they are suffering from some small, ailments. And then sometimes they ask whether we should go for the vaccination, the scheduled vaccine or not. So if she's having some kind of fever or any kind of other diseases, can we just go for the second vaccine, second dose of vaccine?
Yes, she should. She should finish the doses. There is no advantage, though there are studies which show only one dose of vaccine is also going to come in the future. There is no disadvantage to finishing the doses of vaccination.
But in conclusion of all this vaccination against carcinoma cervix, I want to, the Foxy and other organizations should strictly, motivate the government to start it as early as possible. Otherwise, in the last budget, they just initiated some procedures. I don't think that it will materialize. The vaccination against HPV should be a strong recommendations from all the organizations like pediatrics and then gynecology.
So in fact, right now, Foxy, IAP, and the American Cancer Prevention Society have all joined hands, and they are appealing to the government as well.
Yes,
so I think
it should come in national program, vaccination program,
absolutely.
national immunization program, primary immunization for the babies, babies in the sense girls 9 to 14 years.
Absolutely.
So that it will be 100% whatever we are achieving.
In fact, we are finding that a lot of pediatricians are able to overcome these, mindset when they give it at 9 and 10 years of age.
Yeah.
And we sort of confuse the issue by talking about sex and other things. So we should keep the two issues apart and vaccinate as an HPV virus.
Yes, there is one news about this that all our organization are pressurizing government to include HPV vaccination in the schedule. The Rajya Sabha member of parliament from Nanded, we urged him to raise this voice in the parliament, and he had recently, few days back, he had raised the question regarding inclusion of HPV vaccine in the scheduled vaccination program of India. So probably it will work. The doctor,
It will
he is also
hopefully,
he's the
yes,
pediatrician, Dr. Ajit Gopchade, Rajya Sabha
Ajit
MP from
Gopchade.
Nanded.
very
Yes.
nice. So I think as each of us as a Foxian has to also appeal to our local bodies to take the voice forward. And Foxy is also doing a great job in trying to push this agenda forward. So let's quickly move
Ma'am,
on to, yes.
just a point. In Kerala, we have already started using Cervarix like very much. We've been very much using it.
Servavac.
Yes.
Servavac.
Cervavac vaccine by the Serum this
Yeah,
thing.
Institute.
So we
Okay.
are giving and we don't have any side effects and then definitely its efficacy is yet to be proven. But we've been vigorously using it. Even in
Excellent.
institutes as
But
bulk,
you know,
bulk
that is
vaccine.
because it is Kerala. Kerala with such a high education rate and such a high awareness rate and so much being done for the public in that government.
True.
So
But
I
we're
think
just hoping the Cervavac comes out with nanovalent also, like the
No,
strains
no.
39
it's
one
going to
also.
be extremely difficult. So let's not
Yeah.
talent for Servavac. Yeah. Okay. So
Yeah,
I'm
yeah.
going to move to preconception. Do you ask patients for history when they come for preconception counseling?
Yes,
And
always.
hello, I think there's some disturbance, Dr. Anil. There's a lot of disturbance.
He has muted. He's
Okay. So if somebody else would like to take that question,
Yes, we always ask for the immunization history.
yeah. So if the patient should be given a vaccine, should it be rubella or combined MMR?
Rubella, because already they are treated with the MMR.
So here's the thing that CDC advises MMR because many of our patients miss out on getting the 15-year booster dose of measles vaccine. So they say that MMR is a better vaccine to give than only plain rubella. Of course, rubella, the RVAC is extremely cheap. MMR is much more expensive, but it's a better vaccine to be given.
that is same which we give in a pediatric age, or dose is different.
No, it's the same. It's 0.5 ml. It's the same dose. So it's the same dose and pregnancy should be avoided for 28 days. In case the patient becomes pregnant, she should not be advised to terminate the pregnancy. Please, all of you should insist that it is okay for her to continue the pregnancy in case she conceives within 28 days of taking the vaccine. Because this has been found that the risk is mainly theoretical. What about chickenpox? Do you routinely ask for history of chickenpox? And if there's no history, do you vaccinate?
No.
Yeah. No. I also don't. So, though there are so many vaccines that you can vaccinate against, somehow chickenpox I have never actually vaccinated. But the consequences of patient getting varicella in pregnancy, in case she has never had chickenpox, can be quite severe. So keep in mind that you need to check this history before she gets pregnant. And this is just a table from the ACIP guidelines to show that every single vaccine can be given before pregnancy. Of course, meningococcal, pneumococcal, we are not really giving, but if it is indicated, we can give these as well. I think I'm going to skip the pregnancy vaccines and first go to the post, or let us just briefly talk about the pregnancy vaccine. Which of you is going to cover this? Who
Yeah,
would
I
like?
will.
Yeah, Dr.
I will.
Reshma. So what are the general guidelines for vaccination in pregnancy and which vaccines are contraindicated? Please go ahead and tell us.
Yeah, generally live viral vaccines are always contraindicated during pregnancy. And I am telling about the FOXY guidelines, which
Yes.
are advised during pregnancy. First of all, immunization.
can't hear you, ma'am. Dr. Reshma? Dr. Reshma? If Dr. Puneet would like to say something? Dr. Puneet?
Yes, ma'am. Yes, ma'am. I'll
Yeah,
take
Dr. Punita, go
Yes.
ahead.
Live vaccines are completely contraindicated in pregnancy, ma'am.
Yeah.
What we suggest is to prevent tetanus. Earlier, we were giving TT. Now, Tdap is also suggested, but it goes a little costlier for non-affordable patients, like what we get in our setup, ma'am.
Yes.
Though the criteria says that it should be started, the TT is given in the second trimester, we try to give as early as possible so that the women don't miss out on any of the TT doses.
Right. So let's come first to influenza and then Tdap. I'm sorry, but I can't see all the panelists. And Dr. Vidya,
Yeah.
who wanted to speak on influenza? Dr. Lalita?
Influenza versus non-pregnant.
All right, Dr. Punita, you go ahead.
Back, I think she'll be talking about the vaccines.
Yeah. Is Dr. Pranay there? Dr. Pranay?
I
I'm
don't
just-
think he has been able to join.
All right, then somebody can just briefly tell us what are the dangers of influenza in pregnancy and why the vaccine should be given.
Influenza is
More likely to cause severe illness in pregnant versus non-pregnant women. And
Yes.
women in the second and third trimester are at increased risk for the hospitalization, severe illness, and even death from the influenza. And
Right.
high perinatal morbidity and mortality with the influenza. So influenza vaccine is important to be given in the high-risk patient.
Do you think it should only be given in high-risk patients or should be given in all pregnant patients? So here's actually the problem that influenza vaccine is facing, that it has been recommended for all pregnant women. And of course, it should be the inactive vaccine, which is either trivalent or quadrivalent. Currently, we all have only the quadrivalent vaccine available, and that is the vaccine which we should give. Does anyone know the schedule that we use or when we should give it? So I hate to sound like a school teacher, but I'll just quickly brief you that the influenza vaccine should be given in any trimester if there is a pandemic. Otherwise, it can be given in the second or the third trimester. It is better to give the influenza vaccine in the second trimester so that the patient does not get influenza. And the vaccination in the baby cannot be given till 6 months of age. So the maternal immunization will protect the baby as well. So influenza vaccine should be given in every pregnancy, and it should be given irrespective of the time of year that the patient has come. Of course, in the country, in India, in the north, it is typically October to December, that is the season. So it should be given just before that. And in our part of the country, especially the western part and the central part of India, the season is more typically May, June, July. So it should be given before that. Single dose can be given, and literally there are no risks to giving the vaccine. And this is actually what the WHO had put up way back in 2012. So that's almost 12 years ago, that pregnant women form the highest priority group and they should be vaccinated in any trimester. Now, unfortunately, the FOXY recommendations say that you should give it after 26 weeks. This recommendation is hopefully going to change. So it will come to after 20 weeks. And ACOG says that it can be given at any time during pregnancy. So this is what we should follow. Okay, coming to TT, TD, TDAP, which would you give? And somebody to talk about this. I think Dr. Anil wanted to talk about this.
Yeah, TD, TD, TDAP. Now, these now we should keep in mind that we should replace TT with TD.
Very good.
Yeah.
First
WHO
point, and that is the most important. Replace
Important.
TT with TD.
TD, and even the cost of both the vaccines are same, almost same. TT costs 15 rupees, TD costs almost 18 rupees of various brands. So the basic we should replace TT with TD, and those patients who afford TDAP, we should encourage them to take TDAP rather than TD. Even those patients who are not affording TDAP, we should recommend not to take 3 doses of TDAP. They can take 1 dose of TDAP in between the 2 doses of TD. So that will also take care of pertussis in the mother also, and the passive immunity to the fetus also.
So, Dr. Anil, I want to ask you, how many total doses do you give the patient of TT or TD
Yeah,
or TD?
ideally, as per WHO recommendation, we have to give 3 doses. 1 dose in the first dose should be in the at least in the second trimester, and the second dose we usually give after 1 month after the first dose, and the third dose after the 6 months of the second dose. That may come in the periperium also. But these are the standard recommendations by WHO for regarding tetanus or TD vaccination. So, if the patient gets pregnant within 3 years of the first pregnancy, that patient have to take only a single dose in the second trimester, either TD or TDAP.
Do all of you agree with this?
No, TDAP should be given after 28 weeks or 26 weeks, and single dose is sufficient if TD 2 doses are given at 1 month interval.
But do you all agree that you require total 3 doses? Or can you get
No.
So tell me what you would do, Dr. Lalita.
First 2 doses of TD, and they can be given at 1 month interval in second trimester, and TDAP should be given after 26 week to 28 week between. So that pertussis of neonate can be protected till he doesn't receive that DPT.
Anyone else would like to add? Shaila,
Yeah.
Vidya?
Yeah,
Reshma?
sorry, ma'am. Sorry,
Hey.
ma'am. It was disconnected because of some net issues. I think 2 doses of TB in second trimester, both 28 days apart, and the third one after 26 weeks of pregnancy. That
So,
should be TDAP. That will prevent the infant.
I will correct you all. Because the rationale of giving TDAP, which Dr. Lalita said, was to protect against neonatal pertussis. TDAP has to be given after 27 weeks of gestation. So typically 27, 28 weeks you can give the TDAP. The prior vaccination need not be 2 doses. It can be only 1 dose of
booster or
it can be only 1 dose. Because keep in mind that most of the patients have taken TT like pani. Okay?
Every time
have taken TT like water. So even 1 dose of TD should be enough. I agree with Dr. Anil that if you are not sure, or if it is a really poor patient who is maybe a laborer or a worker who is come from somewhere and you don't know any immunization history, only in those cases you can give 2 TD and then TDAP in the third trimester. And here's the thing about TDAP, that even if she has 2 pregnancies back to back within 1 year, she still requires TDAP
for the
in
baby.
each and every pregnancy.
Because that pertussis coverage for next baby. So that's
Exactly. Okay. So Do you co-administer vaccines in pregnancy?
It can be.
Situation based.
It can easily be co-administered. So which two would you ideally be co-administering?
Influenza with TD.
influenza.
Yeah,
Influenza with TD.
TD or influenza with Tdap.
TDAP.
Yeah. Okay. Okay. Now we come to, I think we have about 10 to 15 minutes. So we can now talk about the new kid on the block for older women. So how many of you, just to start the ball rolling, how many of you have actually received yourselves the Shingrix vaccine or have given friends, family, or patients the Shingrix vaccine?
No one.
No?
Doesn't know anything about this.
So I think that Shingrix has been around now for more than 1 year. And let's start the ball rolling by one of you telling me what is this herpes virus, herpes zoster, and what we can do to prevent it. Is it really an important issue?
Yes, very important. Suffering is too much if the patient gets infected.
Right. So I think that is what started the ball rolling for this vaccine, that especially after the age of 50, males and females are at risk of getting this infection. And they are at risk mainly because they have other comorbidities or they start getting comorbidities in an older age group. In fact, you will be surprised to know that my own father got herpes at the age of 92. And he was in agony for 6 to 8 months because of the post-herpes neuralgia. And seeing his condition, I have really gone out of my way to vaccinate males as well as females. I'm seeing male patients in my clinic for the first time, encouraging people to vaccinate. So what is actually the treatment, if any of you know, for herpes virus? So
Antiviral, anti-inflammatory, and
understand that it is different from varicella. Huh? It is herpes. So yes,
Antivirals.
Yes.
Anti-inflammatory, analgesics.
Right.
And some multivitamin also.
Yes. So I think the mainstay of treatment is to begin antivirals very quickly. And I think the drugs which are required go on for many, many months. So, I mean, I know that this is a very brief introductory session to the recombinant zoster vaccine. But if it was available to you, would you give it?
Yeah, sure.
Yes.
Anybody else?
Yes, yes. If it is available, we should give.
Yes.
So it has been available now since more than 1 year. And it has been proven to protect 90%. It offers 90% protection to patients. Where do you see yourself in the management of herpes zoster? Do patients typically come to you first or do they go somewhere else?
No, they go, I think they go to physician.
Physician.
I didn't get it. Dr. Reshma?
Yeah, firstly they go to physician, not come to us.
Yeah.
But genital herpes will always
They come to us. They come to
Genital
us.
herpes we have seen coming to us.
Yeah, yeah. They come to us.
Are you confident in diagnosing herpes zoster?
Yeah.
I think we all should be, because the pattern is very
Neuropathic.
It's a dermatome pattern.
Yeah, typical pattern.
Yes. So
with
right
one-sided, unilateral pattern.
Right. So right now the cost is 11,000 rupees a dose, and there are 2 doses. Do you think this cost is
I think it should be,
expensive, but it is justified rather than suffering.
Absolutely. Rather
It
than
is-
suffering, it's worth taking the vaccine. So,
Dr. Anahita, many a times if you take the vaccine in bulk and go for bulk vaccinations, they are providing it to us for 8,000 also.
yes,
We have
in fact, you are
procured
right.
vaccine at 8,000 and given it in bulk to people, and it has been possible here in Rajasthan also, in Jaipur itself.
Exactly. So that's wonderful.
Yes.
And I think that the more we use it, the more the price will start coming down. And I think, it's not correct for us to always judge that nahi, ye vaccine bahut mehenga hai, so I won't give this patient or I won't offer to this patient. We should always offer the vaccine. Then it's up to the patient to decide whether she needs it or not.
it's lifelong protection.
Yes.
So, yeah. So it's, if, ma'am, I'm so sorry, I didn't get your name.
Vidya, madam.
No, the other one.
Vaneet.
I'm so sorry. The
Dr.
lady
Shubha
from
Sethia.
Rajasthan. Haji?
Yeah, Dr. Shubha Sethia.
Oh, I'm so sorry. If
Yeah.
you could just tell us if it is available in Jaipur, how many
Yes, it's
doses
available.
and how do you give it?
We give 2 doses basically, and it is almost 4 to 6 weeks apart.
Right, right.
Yeah. Because
So,
we have already taken these doses, because at least I have seen at least 8 to 10 cases in my family. So I know what agony it causes. And so we have already taken the dose, the first dose.
exactly.
Yes.
I think all of us who have family members or friends who are affected by herpes can never forget how painful it is.
Yes.
So, what are some of the adverse events? Ma'am, if you would like to continue.
I think local reactions are the only thing that is there. Otherwise, a bit of a fever-like feeling may be there. That's
Absolutely.
it. Yeah.
So keep in mind that however thin or fat your patient is, all vaccines ideally should be given in the deltoid only. And you should
Yes.
giving any vaccine in the butt because there is no muscle there. Typically, there's more fat. So you must give it in the deltoid. So just to add to what Shubha madam said, the manufacturer has helplines and vaccination centers also for doctors and patients. And initially when Shingrix was launched, they were offering all doctors the vaccine at a lower cost. So I think we should all take advantage of this vaccine because at least I know I'm older than 50. I don't know about any of you who are looking so young and beautiful. So the last part, what about influenza?
Yes, I wanted to ask one thing. What is
Yes.
its duration of protection? Is it lifelong?
Lifelong. So how many of you have taken influenza vaccine?
Yeah, all in my family.
I think everybody has taken.
Right. So do you routinely recommend the vaccine to older patients?
Yeah.
Yes. Especially when there is a pandemic.
Okay.
Even to children, we are giving it regularly to all the pediatric patients also. So
you are
almost it should be
vaccinating
given to
pediatric
everyone.
patients. You are vaccinating your pediatric patients?
Not me. My husband is a pediatrician, so he is vaccinating all the kids.
Right. Right. So I think we should keep in mind that older women require care and they also require vaccination. So influenza and Shingrix vaccine should be given to all older women. Shingrix vaccine is only 2 doses, but the influenza needs to be taken
Yearly.
yearly.
Yeah.
What about your staff and yourselves?
We do recommend, but some of the staff they took or some not.
All right. So what are some of the steps, and this is my last slide, what are some of the steps to improve adult vaccination? And I'd like each of you to say something about this.
Educate.
Education, awareness, counseling.
Promotion of life course immunization. Adoption by national guidelines, that will be, if national immunization schedule for pediatric in the same way, if it is a national immunization for the adult, then it will be very helpful to the people.
Absolutely. Shubha ma'am?
I think counseling is the most important. For example, like influenza, we were able to motivate people from the time of COVID, because we said that there will be, so after COVID, probably we are at a better situation as far as counseling is concerned. So we are now in a better position.
What about Dr. Vidya, Dr. Reshma?
Take the influenza vaccine and tell your staff, since I took the vaccine, I didn't have any problem. And the number of days of leave I take is far less compared to you all. And I think such counseling will help a lot.
Dr. Reshma?
In the community, counseling should be increased about the benefits of the immunization. As well, they should also be counseled about the hazards of immunization, apart from benefits.
So
And
if you talk about the hazards of vaccination, nobody will take the vaccine.
No, they should be. I think सबसे पहले क्या होता है? What happens? Patient immediately asks, what are the side effects of this vaccination? If we recommend any to them. So community people should be counseled about that there are no such side effects. Always the benefits outweighs the side effects.
So I tell my patients that if you have a little pain, a little myalgia, a little fever, it means the vaccine is working.
Exactly.
Yeah. So I think counseling, as all of you have said, is extremely important. Any last words? Dr. Anil and the other gentleman from Kolkata are not here. Dr. Anil?
Anaita ma'am?
Yes.
I think even we need to increase the awareness amongst doctors, especially about the Shingrix and the influenza.
Exactly.
Because until and unless
until and unless you are convinced, you are not going to be able to give your patients the vaccine. Until and unless you see one patient who is pregnant, who has died of influenza, you will not be convinced. But you don't need that patient to die to follow the practices. Any last words from any of you ladies?
Vaccination should be taken as a LIC policy. All the vaccination should be planned. We should not pray for the early death, but the LIC plan we take best of best. In the same way, vaccination should be complete. Schedule should be channelized.
Absolutely.
And there should be one tagline: prevention is always better than cure.
Right. Yes, ma'am, you were saying something?
Rubella vaccine can be given after first delivery, before discharge, so that at least there is some protection for the next pregnancies.
Yeah, so basically influenza, Tdap, MMR can all be given in the lactation period. Even HPV vaccine can be given in the lactation period. They are all.
Anaita, just one question that I have.
Yes, ma'am.
Like the basic confusion is between the tetanus TD and Tdap. Like we want the third dose to be given 6 months after the second dose. So,
but I don't agree with that. I don't agree with that at all, because the patients are already immunized against tetanus. At least at 15 years now, the government is suggesting TD to be given. So when the patient comes to you, it's easy. At least I'll tell you the schedule I follow. as soon as the patient is done with the first trimester and comes to me at 12, 13 weeks with the sonography and everything, I give the TD. When they come with the anomaly scan, I give the influenza.
Yes.
And then when they come at 28 weeks, I give TDAP. And this has worked wonderfully well for me. In COVID times, if they missed out on any of the visits, then I co-administered influenza and TDAP at 28 weeks.
Right. But many a times I feel that the 10-year booster is being missed by almost everyone.
In that case, you can certainly give 2 doses of TD,
Yeah.
1 month apart, and give TDAP in the 3rd trimester irrespective.
Yes.
In case you miss out on giving TDAP in the 3rd trimester, you can give it even postpartum.
Yes, that's true.
So I think it's exactly 5 o'clock and
Yes.
late afternoon of chatting. So I thank all of you.
Thank you. Thank you.
And
Thank you so much for a
really
wonderful moderation.
Thank you.
Thank
Thank
you
you.
for
Thank
giving
you.
me the
So
opportunity.
Thank you very
it
much,
was a
madam. Thank
really
you.
wonderful panel. First of all, thanks, Dr. Anhita, for making it such a simplistic approach to the whole thing so that it comes into our day-to-day practice, what we need to take care. That is the most important thing about this. And probably this is how we went about it. And it has really helped. I think even the viewers, it must have helped. And for all of us, it was a helpful thing in the day-to-day practice. And secondly, even all the panelists, they were really giving us a good discussion about everything. So I thank all the panelists also, Dr. Anil, Dr. Reshma, Dr. Shelja, Dr. Vidya, Dr. Lalita, and Dr. Punita for your wonderful participation in the panel. So thank you all very much. And I also thank, I think Dr. Anju Soni had to go somewhere. So on behalf of her, I say that because she had an important meeting with the Deputy Chief Minister, so she had to leave and it was decided suddenly yesterday. So she couldn't just do without it. So, but on behalf of her also, I thank you all very much. And another request which I am putting is that Dr. Anju Soni is standing for the post of Vice President election now, and the election process starts tomorrow. So requesting you all to please kindly vote for her, support her, and ask the people around you also to vote and support her. So all of you know her very well, and you know how dynamic she is, and she will definitely work for Foxy and give us fulfill what we are expecting from her. So requesting you all to vote for her, and thank you very much for being here on such an important topic. So thank you very
Thank
much.
you. Thank you, madam.
Thank
Thank you.
you.
Thank
Thank
you
you
very
so
much.
much.